Greeting to Dr. Diana. My name is WOON. Today I would like to introduce about early intervention. Early intervention is to describe and explain who is eligible for early intervention. Early intervention consists of sustained and systematic effort to provide support to the family, caregiver, and child to promote optimal development for children with disability. Early intervention is designed for family whose children development is different from what is expected for their age, and also designed to support family pattern of interaction of the best promote children's development. To the family who are eligible for early intervention with when their child is identified with developmental delay and established condition or some risk factor. Developmental delay is the child who is experiencing development delays as measured by appropriate diagnostic instrument and procedures in one or more of the following areas. So in total, there will be 6 areas. One is cognitive development, which is the thinking skill, remembering, learning or understanding, resolving, and reasoning of the children. Physical development, including visual and hearing. This is more to about disability in our physical body. So there will be also include in gross motor skill and fine motor skill to be like keeping balancing of the body or be able to use finger to draw, to play and dress and also write. In the third is language development, which is speaking by using body language or gesture, or it can be communicating and understanding what other people say. The fourth is social and emotional development. The child who can't interacting with others or having a relationship with family and friends by operating and responding to the feeling. Lastly was the adaptive development, that the child that can do their everyday tasks to make them can to live independently, like we can include with cleaning or bathing or eating on their own. Early intervention service also include in audiology or hearing service, speech and language service, medical service, nutrition service, occupational therapy, physical therapy, and psychological service. There are some problems for inclusive education in Malaysia. First of it was lack of teaching skill in teachers. It teaches special and regular children as well as disabled children in the same classroom, which is why teacher must be able to deliver an equitable education to all of those children. They should use a variety of teaching technique and strategy depending on the student's personality. At the same time, a teacher teaching skill should be improved so that the teacher can understand and effectively solve the problem of a specific and general student. So, I think that we should provide a correct technique for teachers to teach the students who need our help and with special needs. Second was the study syllabus. When creating the curriculum, keep in mind that it should be adaptable, useful, and appropriate for both regular and special students, as well as its physical barrier. So the government should help on this topic to fix a more relevant syllabus for children, for normal children and also special needs children. Thirdly, there will be a physical barrier where it's difficulty learning and grasp information at a slower rate than other students. They require a greater deal of effort in order to learn, but because these issues are ignored, they are treated with the same behavior, teaching method, tendency resulting in problem. So, this kind of students should have a appropriate study in inclusive education, which they can't fit with a normal student, because they should be giving a lot of manpower and patience for them, so it's not capable in normal school. Lastly, there will be language and communication. This is because language is also one of the way that we teaching and we deliver information and knowledge. So there will be inclusive education also have various of children different background attending the classes. Some children who do not speak the same mother tongue as their parents have difficulty reading and writing. As a result, issues such as language comprehension and communication arise. So this is also one of the big problems for inclusive education. So for my suggestion, we need to increase more manpower in a different language during when they are in a children time. That's all from me. Thank you.